All right, so hi everyone, very good evening to all. So I think I'm live, audible and visible to all of you very clearly. So guys, the big day is over, okay, and yeah, hi Kuldeep. So the big day is over and I do really believe that you all have done, the best of you in today's exam, all right. So now it is a time to little bit relax and first of all, I'll not be directly starting with the orthopedic session. I'll be just taking a brief, insight about how the paper was today. And it is not only for the people who have appeared in the exam, you know it very well, but then for everybody who is planning to appear in the next session or who are going for the NEET exam as well. All right. Hi Kuldeep, hi Aryan. So guys, I had talked to like lot many students today, and I have just prepared a few points to tell you about how the things were little changed in this exam. Okay, so first we are going to have a little bit of discussion how the paper was, and then very quickly I'll discuss with you the questions of orthopedics. Okay, so why the recalls? Why the recalls? To give you the stress? Not exactly. It is just to tell you that, the things that you have been thinking or where all we can have the minutest of the mistakes, the silliest of the things, and we have to keep them in our mind for the rest of our life. Not only for this exam, right? For the rest of our life, all right? So let's have a basic analysis of the paper. Let's have a basic analysis of how the exam was. So the paper analysis, I have talked to the students just after they came and they were like kind of very excited. But yes, they were somewhat little terrified because of few things. And what were those? Let me tell you those. Okay, right. The AIMS has already, the INI basically I should now call it, they have already declared that the paper will be given in the 4 sections. Okay, and each paper will be auto submitted after 45 minutes. Okay, and that was the kind of thing that has troubled some of the student a little bit. All right, so all the 4 sections were there, 45 minutes each for the each section. And then what was the basic problem? The most of the student, majority of the student, what they told me, sir, in the very first section, part A, part B, part C, part D, in the very first section we were very attentive, very alert that I have to finish my subject, I have to finish my these questions in 45-minute duration only. 1/4 of the paper has to be done. I was very alert, okay, but all that energy was consumed in part 1 only. After that, when I went to part 2, the neurons were not that activated. I was feeling little hypoglycemic and things were like, I was just feeling like, oh no, how the time management is to be done. Okay, so this is something that all of our faculties like Dr. Rajat, and all of the time, he has been telling you and all of our faculties have been telling you that divide your time in a proper manner. So time management was something which had taken lot of attention. And yes, in that apprehension, certain questions, they go little up and down, right? So time management was a little issue, especially for the part B and part C, because in part 1 we were very alert. Part 4 we were very alert because we knew that in part 2 and part 3 I have done certain mistakes. Okay, and you are not allowed to go back once the part is auto submitted. You are not allowed to check that what has been done right or what has been done wrong. So we can very well say it is somewhat good, somewhat not good for all of us. Good in a way that whatever has been done is done, it cannot be undone. But then if I now recall that, okay, my question number 3 or question number 10 was something which now I recall my answer was wrong and I need to correct it, that cannot be done. Okay, so you have to be very attentive, very alert in the very first go. And yes, the paper, the PYQs, they played a very crucial role here as well. Kind of 70% of the paper was again from the previous year topics. It was not from the previous year questions only. It was from the topic, as has been told to me. Okay, do correct me wherever you feel like there is some more scope of improvisation in the paper analysis, but this is the analysis that I've got from all the students. We had got more than 100 students today at our center post exam, and I had a word with most of them. All right, so now PYQs were very important. 70% paper were from the previous year topics only. Right? If you are the one who has taken all the papers starting from the year 2020 especially, and if you have gone 2 years back, 2018 till now, most of the topics were there. Kind of 70% paper. Most another important thing that was focused in the paper was absolute clinical emphasis. Now, we all know that now in the recent scenario, recent days, very much, we are focused upon the clinical integration of everything, whether it is anatomy or physio or biochem or whatever it may be, right? So clinical emphasis was given on most of the questions of the exam. And in that same spree, the 70 question out of the 270 questions were the lengthy questions. What is that lengthy question? The 70 question kind of, they were having a language of more than 4 to 5 lines. That means they were kind of time taking. And once you are reading this question, once you are marking the answer for this question and you go to the next one, there is no time left that you come back and review the question again. Okay, that is the 45-minute duration, that is what it has done to us, that if the lengthy question is there, part B, the medicine part was actually very lengthy. It was having the majority question from medicine part, surgery part and OBG part. Okay, and lengthy paper, lengthy questions, it is, time consuming. So that has taken a lot of time. That was a little bit of issue with some of the students. All right. Now, one of the very unusual thing that happened this time were a number of graphs that were asked in the exam. Graph like in relation to OBG, graphs in relation to the physiology. Okay, like you all know in the OBG, we have to make multiple graphs. For example, a lady in pregnancy of so and so weeks is coming to you, and then there are certain vitals which are going up and down, and then you have been given a graph, and then they ask you what is going on right now, like that. Okay, so this paper has been kind of the one which has been giving emphasis on the clinics, and if you have been one of those students who have been involved in the paper making, file making of the clinical parameters of the patient, then it was little easier for you. Okay, so that is what I am saying by the clinical emphasis on the questionnaires of the exam. So image based questions, they were kind of like, as been told to me, like kind of 40 to 50, and another 20-30 questions were on the graphs only. So that was given very importance. Every time you look at the clinical parameters, like in the very recent skill training program that we conducted at Delhi, then we conducted at Ahmedabad, we focused upon how to make a partogram. So like that way, the graphs were given a lot of importance this time. So it makes like kind of 1/3 of your paper, rest 2/3 were the rest of the questionnaires. Okay, but one thing where the INI people definitely need to look upon, where they can have little bit of improvisation, is quality of the images. Most of the students were not very much satisfied with the quality of the images given in the exam. That could have been little better. Illustrations were not that great. Physiology, the images of the muscle, and the actins and myosins, they were working on them, and the labeling, illustration part, the image part was not very good. They can definitely work on it. And the pathology, the slides that were given in the pathology, if you are the one, if you have seen them once, if you are the one, you have been, looking at the picture, the special highlights of that particular slide, then it would have been like little easier. But if you are the one who have to apply some brain that time to find out the answer, pathological slides were also not very good, not with a very much clarity. So image section is something on which the INI people can definitely work upon in the upcoming exam. So the quality of the pictures given for the diagnosis can be little, improvised. All right, that is one thing which I came to know. After that, PSM and pathology, last session also we see little, decrease in the questions from the PSM directly. And this time pathology also, the slides used to be a lot from the pathology subject, but this time the slides were little bit decreased. They were kind of 9, 10 or kind of that 11. So slides were decreased, but then definitely the integration of the pathology with the medicine part, it has been done a lot. Okay, just before me, Dr. Praveen has already taken the session, and he has already kind of integrated multiple questions which were in relation to pathology. So kind of 25, 26 questions have been discussed, but then yes, questions are there, and that shows, pathology or any pre or any paraclinical subject, nothing, is less than very important for us, because everything has to be integrated from those pre and paraclinical subjects only, right? So even if the slides are decreased, doesn't really matter. What matters is the clinical integration of the subject. Okay, so PSM, pathology, they have been like little less. ENT or ophthalm, when I asked specifically from the student about how the questions were, so they were more or less kind of expected topics, right? From the same expected topics of the last few years, we have got the questions, and there were not much of the trouble in identifying the answers, evaluation of the ENT and ophthalmology. All right, and then the preclinical subject, the anatomy, physiology, biochemistry, I told you from physiology we had the graphs this time, and now when I say physiology, it's automatically a part of medicine, right? And in the preclinical, the anatomy, the biochemistry, they were not like less important, they were equally important, and all of their questions were merged up with their clinically integrated part. Like questions of anatomy, I'm just going to discuss with you certain questions which were given importance with a combo, you can say, with the orthopedic part. Okay, so it is not like that, sir, I had no question from anatomy. It's not like that. All the orthopedic is from anatomy only, right? I'm just going to discuss with you. So they are being given a lot of importance with the integration with the respective subject. So for all the students who are going to appear for the NEET exam, who are planning for the next INI exam, now it is a time for you to understand that I don't have to stick to only anatomy. We have to understand that anatomy is making the base of all our clinical subject. And that makes it lot of, it gives a lot of importance to it. Okay, so the clinically integrated part of the anatomy, physio, biochem, patho, micro, it all has to be learned in the class itself, so that the things are little easier here in the INI exam. All right, then overall, AIMS, I can say the INI in its brochure for the very first time when they announced INI, they said that we can ask you 7 different types of question. But in this particular session that we had today, we had only few questions, not all the 7 types. So what all were the questions here? This time, single best response type, yes, it was there. You had to mark only one question. Then it was true or false type. So you were given multiple statements and you were supposed to select that which one is a true statement, which one is a false statement, like that. Okay. After that, we had the image based questions. Definitely image based questions, the graphical questions were definitely there. Matching, like kind of 9 or 10 questions were there, matching side A with side B. Okay. What was missing this time, which has been there in all the previous year exams, was the this sequential arrangement kind of questions. They used to give you some 7, 8 or 5, 6 options, and you were supposed to align them in the sequence, that what is the option A, what should be my second step, what should be my third step, like that. So that was actually missing from this particular questionnaire. All right. So this is the basic analysis. So overall, the crux of the paper that we had today is very simple. The first and second year subject, you had the integrated questions from them with their clinical counterparts. Okay. So anatomy with any of the subject. You can have physiology with obviously medicine part. Okay. Biochemistry with medicine part again. Like that, we had the clinically integrated part. Second, sequential arrangement was missing this time, but then they added the true false time, which was not there in the previous year exams. So true and false was not there till, since I can say from the orthopedic point of view, there was no question from true and false, but from this time, this session we had the very first question of the true and false type. 4, 5 statements given, and you are supposed to find out which one is correct, which one is wrong, true and false. Okay. Then single best response has been always there. The PSM ophthal or the ENT or the pathology, all of them, the previous year recalls of all the subject, the topics of the previous year, they were having a lot of importance here as well. All right. So that is a broad picture we have from today's exam. And I do believe that all the students who are preparing for the upcoming exams will be keeping a close watch on it. And now it is a time to change your way of studying. If you have been thoroughly only reading the theory and not going or thinking about the practicals or the integration, it is a time you should do it. We still have a lot of time for the NEET exam. We still have a lot of time for the INI next exam, obviously. And then you have a lot of scope to improvise yourself. All right. So integration will be must. Clinical things will be must. And we, at DBMCI, I can simply say that all the faculties have been giving their 100%, actually more than that, to give you the best of the clinical integrations that can be actually given for any of the subject. All right. So that is the basic analysis. That is a basic evaluation that we had for today's exam. All right. So I think I have summarized everything in very short 2 slides only, how the paper was today. Okay. So you have to be very much connected to your patients. You have to be very much connected to your wards, clinical postings, and definitely whatever is being written on the paper. Okay, the partograms and all the these graphs that are being made, whether it is in relation to respiratory department, OBG department, basic things hard to be learned all the time, right? So that is a basic evaluation we have. All right. Now let me take up the recall questions of orthopedics. There were kind of 9, 10, 11 questions there, and obviously ortho is not an individual subject. It is having a combo with some other subjects as well. So what were the questions this time? Please do correct me wherever you think the changes are required. Please do add on. So this time, they have gone a little higher step. You all know talus is a very, very important bone. Okay. And all the time we have been discussing in the talus that talus is a bone which has a very high tendency of going into necrosis, right? We all know very well. But this time what they asked is that where do we use Hawkins classification? Classification has been which I have been emphasizing upon in my every lecture, that classification, certain named classification are very important, and they have gone a little away from the routine this time, and Hawkins classification is asked. Hawkins sign, we all know Hawkins sign is seen where? In talus, and for the same talus bone, we talk about the Hawkins classification as well, right? So this was one of the questions, simple theoretical question asked, single best response type, Hawkins sign. What is that Hawkins classification? It is telling about the displacement of talus. So when it is dividing basically Hawkins, it divides the talar fracture into 3 types, type 1 or type 2 or type 3. Type 1 is simply a fracture neck of the talus, which you call as what? Aviator's fracture, the eponyms you always read, the aviator, shepherd, snowboard. Type 2 is the fracture of the talus when the talus is getting a displacement from the tibio-talar joint, and when tibio-talar and subtalar both are getting displaced, we call it type 3. So fracture with a displacement is type 3, fracture with one joint displacement is type 2, and only fracture is what we call type 1, that is Hawkins. And you know very well that necrosis chances are very high in the talus, scaphoid and fracture neck femur bones, right? So this makes it a very, very important bone. Hawkins classification, yes Kuldeep, okay. So this was a single one single response type question. That was one. Second question they gave you, I have like kept all the 3 pictures. So I was not very like clear because multiple opinions I got. So one thing was clear that they had given you the lateral view of the MRI, right? They have given you, they said MRI of the knee is given to you. The lateral view has been given. So image A, if I mark here is a lateral view. Image B, if I mark is a lateral view. And image C is from the front obviously, right? So in the lateral view, they said identify the structure marked. So I got variable kind of opinion here, whether it was a ACL or the PCL. So I want to just very simply clarify. In our classes, what we learned, why we call it an anterior cruciate, because it is connected here on the anterior part of tibia. Okay, so if you have got this picture in your exam, the ligament connected to the anterior part of tibia and definitely going obviously on the posterior part of femur, it was definitely the answer was in favor of ACL. Okay, and if the picture was something like this, you know, posterior part of the talus, my bad, tibia, and it is going to the femoral part here, then it was the answer was in favor of PCL. Okay, so B, you are saying B, everybody is in favor of B. So definitely guys, thank you so much for clarifying it. So ACL was not in the exam, it was a PCL which was given. And if you recall from my classes, I always show you, when we talk about ACL plus PCL, we always talk about no, PCL usually gets what? Avulsions. And I have always shown my post-operative picture to you that whenever the patient comes to you, there is usually a piece of bone which comes out. And what we have seen in that picture, you remember the screw which is all, fixing the bone. Alright. So PCL, this should not be wrong. I do believe the Hawkins, the PCL will not be definitely wrong in any of your, any of the student would have marked it wrong. Everybody should have marked it very correctly. Yeah, great. Thank you. So it was PCL actually which was marked here. Great, everyone. Number 3, very simple clinical conceptual thing. Where in which of the following fractures does the 3-point bony relationship is maintained? What do you suggest? Where is it maintained? Elbow, you know, everybody knows how to make it. Everybody flexes the elbow and see in the class know how to make it. The olecranon, median and lateral epicondyle, where it is maintained. Don't touch the triangle. Okay, don't touch the triangle. So when you have the olecranon here, when you have the medial epicondyle here, and when you have the lateral epicondyle here, they are saying that in which of the fracture, you know, the triangle will not be involved. So either the fracture occurs here above the condyle or the fracture occurs here below the olecranon. Very simple. Don't touch the triangle, no? And that is happening only in one condition. Where is it? The supracondylar fracture. That is a supracondylar fracture, isn't it? So everybody should have marked it very correctly. Perfect. Yeah, Shubhangi, Shruti, Ravi, okay, Arogya, Mary, Krishnitha, okay, Amalu, Anushrita, okay, Sai. So everybody has marked it correctly, no wrong answers here. I'm very glad to see that everybody has been marking it very nicely. Okay, great. Now this one was another very simple and very logical thing, and when we talk about the concepts in the class, and I'm 100% sure that each one of you have marked it very correctly. True statement about Bankart they ask, right? So always how do we learn in the class that anterior dislocation happens, head of the humerus comes in front, this is my right glenoid, anterior margin of the glenoid, posterior margin of the glenoid, and the anterior margin of glenoid is damaged, isn't it? It is damaged. So when anterior margin is damaged, basically it is what you call as Bankart. And how the head goes inferiorly, like no support. So where does it goes? Injury to which part? Superior part or inferior part? What do you suggest? Humerus lesion. What do we call this humerus lesion? You all know. What do we call this humerus lesion? It is called as the Hill-Sachs lesion. It is called as what? The Hill-Sachs lesion, right? And what is a lesion called on the glenoid area? It is called as Bankart. So where do you think the Bankart usually happens? Inferiorly or the superior part? Where do you think? It is always on the anterior inferior part of the glenoid, because when the head goes down, it goes anteriorly and it goes down like that. Okay, so that is the anterior inferior part. No, everybody would have marked it definitely correctly. Okay, so another one. So basics were to be kept in mind, you know, things were to be supposed to be in the mind, and you will be definitely able to answer it very correctly. Yes, everybody has marked it correctly, I'm sure. B, antero superior or antero inferior. What did you mark? B is for what? Ravi, Arogyamaya and Shubhangi. It is inferior one or the this one superior one? What you have marked? So it is inferior one. Okay. So not to worry, whatever has been done, it's already done. It is all about keeping the facts in your mind and to understand when you go to the examination hall, there is always a stress on the mind. Okay. It is all about if you are able to keep calm at that time. All the aspirants who are going for the next INI or who are going for NEET exam, this is a message for you. If you are going in the exam, keep your calm, maintain your calm, stay cool, and things will automatically come to you. You know, that is the whole idea. Anterior inferior. It was avulsion of anterior inferior part. Absolutely great. Great, Mahesh. Thank you. It was avulsion in the option. Injury or avulsion, we are talking about the same thing, that is okay. It is not about the avulsion or injury, concept, it is all about which part. So it is anterior inferior, great, everyone has marked it rightly. Alright, now this I am very very sure, again a correct question from all of you from orthopedic part. So complaining of a female patient, basically they said, I am not very sure whether it was mentioned as a female patient or no. Please correct me here. Was there a mention of any female patient? Was there a mention of any female patient here? Any female was mentioned? So symmetrical arthritis, you know very well, how do we talk about the joint disorders all the time? So symmetrical arthritis involving multiple joint. So polyarthralgia, which is symmetrical, okay, wrist is involved, can't be what? Can't be OA, osteoarthritis, okay, can't be OA. Hands involved, feet involved, bilateral nature, okay, and then morning stiffness is present, swelling and tenderness is present, and we know what are we talking about? The disorder of the synovium. We are talking about what? The disorder of synovium. And what is that? Rheumatoid arthritis, okay. So female was not mentioned, okay, thank you Saloni. Morning stiffness, which is more than 1 hour, okay, I'll write it, okay. D is gout. So ankylosing was not the option there. D is gout, I'll correct it, not a problem. Female was there, Kuldeep is saying female was there, and Saloni is saying it was not there. If somebody can please confirm, okay, if it was not there. So female was there, okay, I'll take that point. Female was mentioned, okay, it was there. So we have a lady who is having polyarthralgia, bilateral symmetrical, no, there is nothing more you need to find the answer, okay. So OA will be knee, psoriatic arthritis will have some other problem, the destruction of phalanges. Alright, great, female was there. Number 6, the same question has been asked in the previous session, 2023 NEET only. It was in 2023 NEET only, that which is the nerve which is, going like this through the neck of the fibula. What was the nerve? It was common peroneal nerve. This was the question of NEET exam 2023, right? This year only. And this time they have made a clinical, way of asking you this. What they said, fracture at the marked site, fracture at the neck of the fibula will produce which kind of gait? You know very well that if the common peroneal nerve is paralyzed, if it is, injured, what will be the presentation of the patient? The presentation of patient is foot drop. Yes, presentation of the patient is foot drop. You know it very well. Okay. And if the patient is having a foot drop, what kind of gait the patient is going to have? Will he be able to lift the normal, limb properly and bend the ankle properly? No, it will not be there. So what kind of gait? So they have gone into the gait picture, clinical, which one do you suggest? Should it be a normal gait? Should the ankle be able to, take all your weight and go onto the foot like that? Should it be? Okay, so yeah, foot drop, absolutely. It is what you call as the patient has to lift his knee to a higher level so that when the foot got dropped, the knee goes at a higher level. The foot, it is flail now, it goes back. So that is what you call as stamping gait was an option. Okay, which one was not the option then? Stamping gait, I am writing here, stamping gait is one of the option. Okay, what was not the option? Please correct it. So it has to be a high stepping gait. Absolutely correct. It has to be a high stepping gait. Absolutely correct. High stepping gait. Absolutely right. Okay, it has to be a high stepping gait. I do believe everybody would have marked it very, very correctly. No, very, very correctly. So simple thing. Okay, so keep the concepts clear. Not antalgic. Antalgic was not there. Okay, great. Okay, fine. Okay, so stamping gait, I'll write in place of antalgic gait, but it is not there. Okay, or one of the option was stamping gait. I've written it. Thank you so much for the correction here. Exact option was stepping gait, high stepping gait. Okay, so it was high stepping gait. I'll correct it here as well. Antalgic, I've deleted already, Ravi. I've deleted already. All right, so that was the question number 6. So see how basic things can be there. Trauma, the nerve involved and their presentation. That is very, very important. Okay, it was very, very important. All right, this was a question, this was a question which was like, obviously it is a question of anatomy, then why it is important from orthopedic point of view as well. I have been told that these were the 4 options, and please do correct me if I am wrong here. Please do correct me. The intrinsic muscles of the hand, always in the classroom, how we have been discussing it, intrinsic muscles of the hand, they are 20 in number, and whenever they all are paralyzed, they are not working, the hand will get into the claw. The clump case, causing the complete claw hand. So all of following are the intrinsic muscles of the foot associated with the foot area. See, we know the foot will be having intrinsic muscles in the 2 groups. Obviously, there will be a dorsal group and there will be a plantar group as well. okay, there will be a dorsal group and a plantar group. When you talk about the dorsal group, okay, so please do correct the options also here. Please do correct the options also here. So when you talk about the dorsal group, you know that you have got two extensors on the dorsal side. We have extensors only. So it is about the extensor digitorum brevis and the hallucis, also extensor hallucis brevis on the dorsal side. Okay, please correct, help me with the options here, right? In the plantar side, we have got the muscles in 3 layers. We have got the muscles in 3 layers, no? That is a basic anatomical structure. That is a basic anatomy you all know. So in the first layer, we have certain muscle, then we have the second layer, then we have the third layer. So if I go only with the extensor digitorum longus or the digitorum brevis, then brevis obviously is a part of it, right? Brevis is definitely a part of it. Please help me correct the option here, okay? But when you talk about the adductors, you know, adductor hallucis, if it was there or no, I'm not very sure. I'm not very sure. Other than these two, rest of the two, the adductor digiti and extensor digitorum longus, actually, they don't make much of the part of the intrinsic muscle, okay? So please correct me. Multiple options are there. Lateral, which of the following muscles are supplied by lateral plantar nerve? Okay, great. Now the question is absolutely changed. Intrinsic muscle is supplied by lateral plantar nerve. Okay, I'll just correct it. So the muscle supplied by lateral plantar nerve. The muscle supplied by the lateral plantar nerve. Okay, was that the only question? One option was flexor accessories. Okay, so many options we have. So please help me correct the wrong ones as well. Please remove the flexor accessories you are saying. Okay, then you are saying dorsal and palmar interossei as well. Was there so many? Dorsal and palmar interossei you are saying. Okay, any other? Flexor accessory, okay. So variability in the language now. Okay, please help me with that. Okay. Okay, so what was not there then? All of them were there, all the options were there, multiple correct were there. EDL wasn't there in the option, okay, it was there, not there in the option, okay, fine, I'll correct it. Multiple muscles were asked, abductor hallucis, both were given, abductor hallucis and adductor hallucis, okay. So abductor hallucis you are saying is also been given. So you know the lateral plantar nerve, it supplies most of the deeper muscles. ADL was not there, okay, I have cut it already. Option C is not there, adductor hallucis, abductor. Okay, fine. So you know very well that, you know, all the plantar interossei, basically dorsal interossei muscle, they all are supplied by the lateral plantar nerve only. Okay, so out of these muscles, if I take one, I have to go with the adductor hallucis, that is definitely supplied by the lateral plantar nerve only, the adductor hallucis muscle. Interossei and all, if you want to cut others as well, so it supplies the adductor hallucis as well as basically the flexors, right? It supplies basically the flexors here. What is that? Eighth term, muscles were in, multiple muscles were in single option. Okay, Chandrakant, thank you for the clarification, Chandrakant. So if I have to choose one, obviously here, I'll be definitely going with the adductor pollicis. If I have to choose one, adductor hallucis, and if any of the flexors are given, then it supplies basically on the flexor side, right? So abductor hallucis, multiple choice. I got your point, Amalu. I got your point. So this was the question. So we have to change the language here. Okay, we have to change the language here, right? So adductor hallucis is definitely, and all the flexors, if anything else was there as well, right? That has to go in the correct one. Now this was something new for this time from orthopedics point of view, which was not there in any of the previous sessions, right? True and false of the following statements. Okay, Atharva has given some corrections with the option of the previous question. Okay, Atharv, thank you. I'll save it for the reference. Now, eighth one was mark the statement true and false out of the following statement. I think no options, no chances of mistakes here. Most common bone fracture in the wrist, is it lunate? Is it so? Actually, no. It is the most commonest bone to do what? It is the most commonest bone to dislocate, right? Most commonest bone to fracture is scaphoid in the wrist. Absolutely true. You know it very well. 95% of the fractures of the carpal bones, they are comprised of either scaphoid or the triquetral bone. Right, rest of the 6 carpals, they hardly make 5% of the trauma. Scaphoid fracture is related or associated with glass holding cast. Is it so? like that. Is it so? 100%, that is true. Okay, the glass holding cast for scaphoid and for the plaster, when you talk about the Colles injury, you give it how? The palmar flexion and ulnar deviation. We call it what? The shake hand or the handshake position. Alright, so that is also true. Osteonecrosis is related with the navicular bone. See, we can say that necrosis is something which can happen to any bone, but then more than osteonecrosis, if the options are correct, please correct me here, if the option was osteonecrosis or was the option osteochondritis, because as compared to necrosis, osteochondritis is more common in the navicular bone. As compared to the necrosis, osteochondritis, option D was not the same, I guess. Okay, so please help me correct it. Second option was most common site of scaphoid is waist. Okay, so they have asked most commonest site was asked. Okay, most commonest site was asked. Okay, osteonecrosis of lunate called Kienbock disease. Last option. Okay, osteochondritis of lunate. Yeah, it is associated with lunate bone. If it is option, then it is true. What do we call it? We know that it is called as Kienbock's, right? We know it is called as Kienbock's. Okay, great, great. It was scaphoid bone in the option osteochondritis. Okay, so there was nothing related to navicular. Can you please correct me? Was there anything related to navicular as well, or osteochondritis? ABC is saying osteonecrosis of lunate. It was given as last option. Some of you are saying osteochondritis. If some of you can please clarify, was it like Kienbock's osteonecrosis of lunate, or was it the osteochondritis of navicular? D was Kienbock. Okay, point taken. Point taken. Then it is not. Then it is not basically the chondritis leading to necrosis. Okay, it was not there. Fine, it was not there. No navicular. Okay, point taken. It was not navicular. This is wrong. So it was osteochondritis or osteonecrosis. Great. Then it suits in. Then it suits in. So we have got 3 statement true and 1 statement is false. Okay. Then we have got 3 true and 1 false. Great. Thank you guys. 9th one was positive Trendelenburg. Positive Trendelenburg gate indicates involvement of what? Again, as told to me, it has been the multiple correct option type, right? It has been the multiple correct option type. So what all are the correct one? The true and false here. Is this involved? Yes, this is involved. Is this involved? Actually not the complete one. Is it involved? Yes. Is it involved? Yes. Okay, I think it was except question. Okay, if it is so, I'll go with that as well, not a problem. So positive Trendelenburg ACD, yes. ACD, yes, absolutely correct. ACD, yes. I think it was the except question. Truth, this was multiple correct. Okay, okay. So this was a multiple correct kind of question. I'm writing here. This was a multiple correct kind of question here. It was in writing here. All right, great. This is fine. This is fine. Okay. This is fine now. Not except multiple correct. I got your point. Okay. Yeah. So these were the questions that I was able to recall. Am I missing anything? Am I missing anything? Would you like to add on? No, it was not except question, not except point taken. If was there any other like question that I'm missing from here? If you'd like to like inform me, please do message me directly. I think most of you already have a connect with me, and you can very well connect with me directly on my WhatsApp or directly on the Telegram group, DBMCI Premier group, or maybe my group. You are free to like engage anywhere you want. Okay, just share with me if there is anything else you want me to add up here. Okay, and now it is a time to relax. Please do not get into the bad mood that my particular question is okay. Ortho, I believe, was a decent part which we have done pretty well. All right. So I do believe all my students, you have been able to mark most of the questions here correct, and definitely, things will be on the right track for us. Okay. So stay hopeful, enjoy the day. You have done a lot of hard work. You have already given a lot of time, energy, and it is a time to just recharge yourself. Okay. So just go somewhere, have some party, have some fun, and definitely just in a couple of days back, whatever the result might be, if some of you are planning to, this was just a trial attempt of INI, and if you're planning for the NEET, then get back on the track, okay, in just a day or so. Don't waste much time. And if you are the one who has only the aim of like going for INI, let's hope for the best, and definitely our wishes are with you, and hoping to hear from each one of you that, sir, yes, it's done and we did it. Okay, so my bestest wishes to all of you guys. Okay, so just enjoy for the day and don't take the stress of the recalls. It is just for us to find out the silly things that might be going wrong in the tense environment. Okay, so that is all from my end. All right, so just enjoy, and we are there with you all the time. Whenever you need some, anything from our side, feel free to connect with us all the time. All right, so all the very, very best for your results, and hoping to hear from all of you guys. All the very best. We have the series of session going on, okay, and just stay tuned, and all the other faculties are in the line, you know, they will be doing the recalls constantly, okay. So thank you so much guys for being here. All the very best. Thank you so much. Doing